Hello friends, welcome back to my channel. Do subscribe it and do like in case if you like it. So, we all have heard about the term, people are not able to breathe. I find it very difficult in breathing. And across with so many years of experience, I have seen patient coming up and often telling me, doctor, I'm not able to sleep in the night. I'm not able to breathe properly. So this is the most common condition prevailing, that is asthma, and I'm going to talk today on asthma. So what is asthma? So asthma is a condition where our airway passage becomes narrowed down, it becomes inflamed and swells up with lot of production of mucus, where the member or the patient finds it very difficult in breathing. So he can take breath in easily, but he cannot release it out. That leads to suffocation or shortness of breath. So practically what causes this? So it is a combination of environment and your genetic factors. When I say genetic, it runs in my family or in our family. When it says environment, we have got multiple factors associated with it. The first being the allergens, could be your dust, could be my pollen, food like mushrooms. It can be other factors, could be medicines. So these are my external factors. Coming to my environment, could be the cold season, could be the rainy season. Plus excessive physical exercise can also leads to asthma. So these are the causes that I have seen in my practice which triggers an asthmatic attack. So who are at risk? Not everybody who does exercise, not everybody who are exposed to dust get this. So people who are smokers, people who are overweight, who have a family history of asthma, and some of the occupation or jobs leads to asthma. Could be people who are working with chemical industries, people who are working with dye industries, they are prone for this asthma. So what happens if I do not take any treatment, if I try to manage, self-medications? First thing is it interferes with our day-to-day activity, where I find it difficult going to job. I find it difficult to perform my day-to-day activity. Second, I can damage my air pipe permanently. It can narrow down permanently, leading to inability or difficult breathing throughout my life. So what are the common signs and symptoms? How do I identify that, okay, this is an asthma? The first thing that I see is shortness of breath, where patient come and tell, doctor, I'm not able to breathe. Second is, tightening in chest. They are not able to expand or release their breath. Third thing is difficult getting to sleep. They say, I try sleeping it, but I get up, I'm not able to breathe. They have to sit. The fourth thing is very, anxiety, lot of stress. It can also trigger to my asthmatic attack. So with all this, what do I do? How do I prevent? The first thing is I need to identify what is causing asthma in me. I have to come up with an asthma plan. And the most important is taking regular medicines. So what is the medicines that I commonly prescribe, and I have seen patients are benefited with taking these medicines and they are able to resume back to their normal day-to-day activity. Spongia is medicine of my choice. I prescribe Blatta, mother tincture, then R43 and golden drops. So these are the most important medicines I prescribe, and I have seen wonderful results with these medicines. When it comes to Spongia 30, 10 drops 3 times per day. Blatta mother tincture. This to be given in water, 15 ml of water, 15 to 20 drops 3 times per day. Apart from these two medicines, golden drop should be given simultaneously 3 to 4 times 10 drops per day, and R43 3 times around 12 to 15 drops per day. With these medicines, the patient should also change their lifestyle, should get into a healthy lifestyle, they should cover their nose whenever they are going or stepping it out, a good diet, where they need to increase their body resistance. So along with these medicines, a bit of change in lifestyle, I have seen I'm able to manage patients coming up with asthma attack, leading a painless life where they're not having any trouble falling back to sleep nor their day-to-day activity. So this is all about asthma from my end. Do subscribe and like my channel. Thank you so much.